Hello, my name is Nick. I'm going to be your nurse today. Before we begin, can you please tell me your name and date of birth, please?
My name is Aisha Mustafa. Date of birth is March 1793.
Alright, that matches. So what brings you in today?
I'm just here to get a yearly physical.
Yearly physical? Alright. Do you have any allergies to medications?
No.
Do you have any allergies to the environment or to food?
No.
No allergies. Are you taking any medications currently?
I'm taking iron pills.
Do you know the dosage?
It's the 325 milligrams every other day.
Alright, and no other supplements or anything like that?
No.
Okay. Do you have any medical history that you're aware of? Any hypertension, diabetes?
No medical history, just anemia, mild anemia.
Do you have any family history that you're aware of?
My mom and dad both have hypertension, but no other history.
And both your parents are still with us?
Yes.
How old are they?
My mom is 60 and my dad is 63.
Alright. Do you have any siblings, Miss Aisha?
I have two siblings.
And what are their ages?
My sister is 23 and my brother is 25.
And they're both pretty healthy as well?
Yes.
That's good. What do you do for work, Miss Aisha?
I am a resident doctor.
Alright, and how long have you been doing that?
2 years.
2 years? Very nice. Do you generally feel safe at home or at work?
Yes.
Are you ever exposed to any environmental hazards at home or at work, maybe radiation in the hospital or like loud noises?
No.
And have you ever been diagnosed with any like anxiety or depression or any other mental health disorders?
No.
Alright, I'm going to be asking you a series of questions regarding your body systems, so integumentary, like your hair and skin and nails, your lymph nodes, heart, lungs, things of that nature. Alright?
Okay.
So have you first your general health, have you experienced any fevers or chills recently?
No.
Any unexplained weight loss or weight gain?
No.
Do you generally sleep well?
Yes.
That's good to hear. Have you noticed any thinning of your hair recently?
No.
Have you noticed any lesions or wounds on your body that are slow to heal?
No.
And no new moles or anything?
No.
Have you experienced any nosebleeds recently?
No.
Any changes in vision?
No.
And any changes in hearing?
No.
Have you experienced any swelling on your neck recently, like any swollen lymph nodes?
No.
Have you noticed any changes in your voice at all?
No.
And have you had any sore throats recently?
No.
All right, looking good so far. Have you ever experienced any palpitations in your chest, any heart palpitations?
No.
Any unexplained fatigue?
No.
Or feeling like you might faint?
No.
And have you experienced any swelling in your lower extremities and your ankles at all?
No.
Have you experienced shortness of breath recently?
No.
Any difficulty breathing?
No.
And have you experienced any, have activities do activities make you tired that shouldn't make you tired? Do you feel tired as you climb the stairs?
No.
All right. Has your diet been pretty much the same?
Yeah.
Any changes in diet?
No.
Have you noticed any changes in your bowel habits, going more frequently or not as often?
No.
Have you experienced any nausea or vomiting recently?
No.
Have you experienced any changes in urination, like going more frequently or not as often?
No.
Have you ever experienced any pain while you go?
No.
Or burning?
Mm-mm.
All right. Have you experienced any head injuries in the past?
No.
No head injuries? What about seizures? Do you ever experience seizures?
No.
And do you ever feel dizzy?
No.
All right, Miss Aisha, this all looks very good. I'm going to gather a set of vitals and we'll continue on with the assessment, okay?
Sounds good.
First, I'm going to take your blood pressure. We'll do a two-step method. So first I'm going to find the occlusion pressure. Your department's an arm.
Left arm.
Excuse me. I'm just going to pop the brachial artery. Found that. So I'm just going to inflate my cuff until I can no longer feel that pulse. It doesn't want to collaborate. I'll just hold this. Alright, I felt the pulse stop right around 100. So deflate my cuff and give your arm a second.
Okay.
shape. I'll plate my cup to about 130, a little higher than the occlusion pressure. Alright, pressure is 110/76. Is that about what your pressure usually runs?
Yes.
Alright, next I'll assess your heart rate. I'll do that through the radial artery. You can keep your watch on. I'll need to assess this for a full minute. Alright, so the pulse is 62. And while doing that, I assess the respirations at 14 per minute. Both of these are within normal limits. These are good normal findings. Are you in any pain right now?
No.
No pain? Alright. So from there, we'll go ahead with the anti-cell assessment.
Can I put this?
Yeah, that's fine. So we'll start with assessment of the cranial nerves. First one will be cranial nerve 2 for confrontation. How we'll do that is we're going to have to put one card over each eye. It'll be my right eye, your left eye. So I'll bring a hand into the field of view. Just let me know when you see it, okay?
Okay.
So cover your eye with this.
Which eye?
So it'll be my right, your left.
Okay.
Right? Alright. So I'm going to bring my hand into view. Just let me know when you can see it. Just say yes when you can see it.
Yes. Yes. Yes.
Alright. Then the other side.
Yes. Yes. Yes.
Alright. Peripheral views are full. We're done with that. Next cranial nerves 3, 4, and 6. I'm going to assess extraocular movements. So just follow my pen with the light, or follow my pen with your eyes. Alright, and just keep looking. I'm going to bring it towards your nose. Excellent. Alright, I'll be looking at your pupils next. So I'm just going to bring the light into your eyes and determine when your pupils retract. pupils are equal around reacting to light and accommodating. That is excellent. Next, cranial nerve 5, I'll be assessing the TMJ muscle of your jaw. So I'm going to put my hands on your jaw and have you open your mouth, close your mouth, and clench your teeth together. Right. You can open your mouth and close and clench really tight. Excellent. Next one will be cranial nerve 7, so the muscle of your face. Can I have you puff your cheeks out for me? And raise your eyebrows. Looks good. And cranial nerve 8 will be the whisper test. I'm going to come behind you, slightly behind you, and just whisper a couple of letters and numbers. You tell me what you hear, okay?
Okay. 1, 2, 3.
Excellent.
ABC.
Excellent, very good. And cranial nerves 9 and 10, can you swallow for me? And one more time. Excellent. Cranial nerve 11, I'm just going to have you say light, tight, and dynamite for me.
Light, tight, and dynamite.
Sounds good. And cranial nerve 12, can you shrug your shoulders for me? There you go. And can you turn your head against my hand? And other side. Alright, awesome. Thank you. Next, I'm going to go down to the cardiovascular assessment. So, I'm going to be assessing the skin right above your chest. We'll be looking for any heaves or lifts or any bulges, things of that nature. So, I'm just going to place my hand right above the heart. Looking for any heaves or lifts. Feels okay. Let's go into the heart. Alright, I'm going to listen to 4 spots around your heart. So this is going to go right underneath your gown. Is that okay?
That's okay.
So the aortic, pulmonic, Erb's point, landmark, tricuspid, and the mitral point is going to be the 5th intercostal. Can I have you just undo the top of your gown for me? Thank you. Okay. I need to assess with my bell also.
Okay.
So same spots. Aortic, pulmonic, tricuspid, and the mitral point. Okay. I'm gonna assess your carotid arteries next. First off, palpate. Excuse me. Alright, pulse is strong on that side. Pulse is strong on that side as well. And I'll just listen to your carotid arteries next. Cut the scope real quick. weeks on that side. No turbulence or vibrations. And that side is clear as well. All right, I'm just gonna feel for your lymph nodes next. So first the preauricular, right in front of your ears. Postauricular right behind. Occipital towards the back of your head. Submental underneath your chin. Submandibular right behind the jaw. Tonsillar. Supracervical. Deep cervical. And supraclavicular. Alright. Don't feel a lymph node, so there's no swelling there, which is a good finding. I'm going to assess for the trachea next and make sure your trachea is midline, so I'm just going to feel right on your neck. Just place it a little. On the other side. The trachea is midline. Alright. Next, I'll just listen to your lung sounds. So I'm placing my stethoscope on your chest and back. Each time, just take a deep breath for me.
Okay.
So I'll be listening to 6 spots on the front. Ready, deep breath in. And other side. Alright. And again. And again. And once more. And again. Alright. And I'll be doing the same on your back. It'll be 18 spots on your back. Can you turn and face that way for me? Same thing, deep breath in before my stethoscope. And again. Doing good, doing good. And just a few more. And once more. Alright. The lung sounds sound clear and equal all the way around. Just keep facing this way for me. Next, we're going to assess tactile chromitis. So I'm going to place my hands on your back. When I do, just say 99 for me.
99, 99, 99, 99, 99.
Alright, sounds good. So no extra vibrations there. So I'm going to assess your upper, you can face front now. So we'll be assessing the abdomen next. For that, it might be best if you just lie flat on your back. Need assistance? So for this one, I'm going to have to lift up your gown and see your stomach. I'll try to cover the camera as best I can.
That's fine.
Keep you covered. So I'm going to assess the skin of the abdomen the abdomen is flat, symmetrical, no lesions, skin feels warm. I'm gonna go ahead and listen to your bowel sounds. Sorry, the left lower quadrant, or right lower quadrant. Bowel sounds are present. Presence in the right upper. Left upper. Left lower. We're gonna go ahead and listen to the vessel sounds, so the aortic vessel, the renal vessel, the iliac vessel. Starting from the aortic. Notes renal blood flow. Renal. And the iliac vessels. Alright. Next, I'll just do some light palpation of your abdomen. Any pain as I'm doing this? Okay.
Okay.
Must be the epigastric region. Okay.
Okay.
Excellent. So we'll just go ahead and overview. You can go ahead and stand and sit up straight now. Next, I'll be assessing muscle strength in your hands and muscle strength and range of motion. So first things first, you just go ahead and bend your hands forward and backwards for me. Not just there, just your hands, like forward at the wrist and back at the wrist, and the elbows forward and back, and the shoulders can go up and out. Looks good. So range of motion is there. And for the strength, you just push your hands out for me. And back in for me. And that's your elbows. Can you try to bend I'm gonna try to bend your hands forward as I push back down. And the other way. That's excellent. I'm gonna assess capillary refill. In less than 2 seconds, indicating good perfusion. Next, I'll go to the lower extremities and do the same thing. So try to push your feet up against my hands. And down and away. And you try to push your knees up against my hands. And out. I'm going to assess for edema. There's no edema of the ankles. I'm going to go ahead and assess the deep reflexes. So starting with the biceps tendon. Come on the side. Going to shake your arm out, get it real nice and loose. Alright, looking for slight flexion on the arm here. Alright, +2 on that side. I'm going to do the tricep on this side while I'm still over here. Just let your arm hang loose and free. Looking for flexion in this stuff. Looking at flexion in this one as well. Alright. Same thing on the other side. So let your arm rest on that. Flexion. The tricep. Alright. Next 2 on the reflexes. I'm going to do the patellar. Just looking for that extension of the knee. Yeah, lift your foot up. Thank you. And other side. Alright, and then the Achilles. So for this, it may be easier if you sit in this chair. So if you're off the ground. Thank you. So I'm just going to support your foot. I'm going for a slight plantar flexion after the strike. Alright. Other side. Very good. +2 on the deep tendon reflexes. This is a normal finding. Next, I'm going to assess your sense of light touch. I believe I brought a Q-tip, yes. So for this, I'm just going to have you close your eyes, stick your arm out, and just let me know when you can feel the Q-tip on your arm.
I feel it.
Alright.
I feel it.
Alright. Light touch is intact. Next, I'm going to assess kinesthesia, so just let me know. I'm going to wiggle your finger up or down, just let me know if you can feel it going up or down.
Up. Down.
Excellent. You can go ahead and open your eyes and put your arms down. I'm going to go ahead and assess cross-vertebral angle tenderness. So this will let me know if there's any inflammation or anything in the kidneys. So I'm going to place my hand right on the small of your back here. And you go pretty hard. Just let me know if you feel any tenderness, okay?
No.
No tenderness?
No.
No tenderness? Alright. So I believe we have gone through all the systems. So that will conclude my head to toe assessment. Do you have any other questions for me, Miss Aisha?
No questions. Does this mean I'm okay and I don't have to do this until next year?
Just a no, yes. So I'm gonna give this information to the doctor. He'll be in to see you shortly.
Okay.
After that, we'll take it from there. Okay.
That sounds good.
All right. Thank you for your time and patience.
Thank you. Nurse Nick.